Moving into our next vital sign would be pulse and respiration. Pulse and respiration really work in conjunction with the circulatory and the respiratory system in the sense that we're monitoring the beats per minute for the heart and then how many times a person inhales and exhales per minute. So they are related because the heart and the lungs do work together. And normally, if you see an increase or decrease in one, you can expect to see an increase or decrease in the other. With our pulse, let's start with our normal range. A normal adult pulse would be anywhere from 60 to 100 beats per minute. What that means is that that is the amount of times the heart is beating one cardiac cycle at a time per minute, 60 to 100. We have some terms here in bold. We have tachycardia and bradycardia. And taking us back to our medical terminology, remember cardia is in reference to the heart. Tachy is a prefix that means fast, so greater than 100 would be a rapid heart rate, whereas brady is a term that means slow, so that's going to be a slower than normal heart rate, bradycardia. What we're looking for in the pulse, not only is the beats per minute, but we also want to take heed to the type of pulse that we're obtaining. Is it a nice, strong pulse? Does it have a regularity to it? Is it thready? Is it hard to feel? Is it irregular? Those would be different notifications that we could document in reference to the volume of blood that we may be feeling pulsating through the arteries. And so with the pulse, we are palpating the artery against the bone. And just like you can see here in the picture, you would take your two fingers and typically right between your thumb and your pointer finger is where you can obtain your best pulse. So in between these two fingers here, you want to trace down. That's going to place you right in this area here. Two fingers right on that area there. You should be able to feel a nice, strong, consistent pulse. Now, if the pulse is nice and strong and consistent, almost predictable, what you can do is you can record the beats that you feel per minute for 30 seconds. This will require a secondhand watch or a watch that's able to give you the seconds or the minutes. So 30 seconds is what you would feel for. And after that 30 seconds, only for a strong pulse, you can take that final number, multiply it by 2, and that would equate to the beats per minute. So for instance, if you had 30 seconds and you monitored 35 beats for that 30 seconds, we're going to take 35 times 2. That would give us 70 beats per minute. This only works for accuracy when you have a normal, strong, consistent pulse. For a pulse that's thready or inconsistent, you're going to want to monitor for the full minute. No math needed there. Whatever the number is that you have after that full minute is what you would document. So 60 to 100 beats per minute would be our adult average. Now the pulse is measured by using what's called the radial artery, and that's going to be the most common. You want to stay away from utilizing your thumb at all when you are palpating or feeling for a pulse. And that's because your thumb actually has the strongest pulse. And sometimes we can confuse our own pulse with our patient's pulse. So 2 fingers, or just like here, what they're showing in the picture, you can use 4 fingers. In any case, still counting for 1 minute if it's a nice strong pulse, if it's a thready pulse or if it's a strong pulse, you're able to do 30 seconds, multiply that number by 2. For our pediatric patients, because they come with their own share of extra chub, right? They've got that extra fatty tissue. Sometimes it's a little bit harder to be able to obtain a radial pulse from them. Best location is going to be at the apex. And the apex is located at the base of the heart. So what we would obtain from our pediatric patients is called an apical pulse. Apical pulse requires the use of a stethoscope, and the technique doesn't change. So at the base of the heart, near the 5th intercostal space between the ribs and the left side of the sternum in the chest, you're going to listen for the beats per minute. The beats per minute should be the same. In fact, as far as how we would document, would still be either 30 seconds or 1 minute there. Now, I just want to go back and explain what intercostal spaces mean. I believe that's a new term for us. And so if you're looking here at the anatomy, this is called the sternum, right in the middle of the ribs that divides the ribs on a right and a left side. That would be the sternum. And so intercostal spaces are these spaces that are in between the ribs. Very easy to feel when an infant is lying down. You would start with the clavicle, which is really almost like the shoulder or the collarbone, if you will. You feel for that area there, and then you can just roll your finger down very gently there, and you'll feel a little dip. That's what's called an intercostal space. And locating the apex, you would determine 5 intercostal spaces. And when you get to that 5th side on the left side, that's where you're going to obtain your very best apical pulse for a pediatric patient. Again, a stethoscope is required for this method. Here in this diagram, it shows all of the pulse points that we have available for us in order to be able to obtain accuracy. Most common for us will be the radial artery there located in the wrist. Also, another common area would be the carotid artery here just below the patient's chin. Remember, apical for our peds patients, and all of these other areas aren't typical for us, but it doesn't mean that they're off limits when it comes to obtaining a pulse. These are all safe, obtainable pulse sites.